This conference will now be recorded.
Welcome to the first class of the Bariatric Nutrition Program from Community and Monmouth Medical Centers for Bariatrics of Robert Wood Johnson. If you are watching this video, you are beginning our bariatric program. So welcome. My name is Victoria and I'm the registered dietitian who you will be working with throughout the process as you prepare for your bariatric surgery. During this class, we're going to be discussing some changes to nutrition, which will set you up for healthy weight loss. I'm going to introduce specific eating habits which will result in successful weight loss. So we're going to discuss some of the new ways of how you eat, what you eat, and why it is important. Depending on your insurance, you have about 3 to 6 months to practice and build these new habits to make it easier for you to start doing this after your surgery without, any issues readjusting. You are going to receive a nutrition guidebook, such as this one, in their file. This book has everything you need to know about bariatric nutrition before, during, and after surgery, and we will be using it as a reference throughout all of our sessions. It has all of the information you need to guide you through the process of preparing for bariatric surgery. So before we begin, I'm going to do a quick breakdown of this book because it is a lot of pages. It is a lot of dense reading, so this tends to help prioritize what to read first. So the first half of the book, up till page 40, is really the focus of nutrition. The first 20 pages is what you would need to know before surgery, and the second 20 pages is everything you need to know for after surgery as to how to progress from liquid diets to all the way back to solid foods. So this is the information that we will be covering throughout our individual sessions and the final nutrition pre-op class. The second half of the book also has useful information, which you can refer to about exercise, some psychological self-reflection, nursing materials, which are, discuss everything that happens in the actual hospital right before your surgery and right after your surgery. And then finally, at the end, there's a journal for any kind of progress tracking, self-reflection, whatever you feel is helpful. So let's discuss the new eating habits. Basically, the central theme for all of your eating and drinking is going to be small and frequent. That is the name of the game when it comes to bariatrics. So this means small frequent meals and small and frequent sips of water. Your goal will be to start practicing eating on a schedule and essentially avoid skipping meals. That's one of the most important things that will have to be relearned if you're currently a 1 meal a day type of person. During this process of building healthier eating habits, you'll also, we'll talk about learning hunger cues and how to stop eating when you're full but not stuffed. And again, you will have plenty of time to practice these habits and make them the new normal. You may even find they feel good, even if you haven't had the surgery yet. So the how of eating essentially involves slowing down. A lot of people tend to inhale their food, eat quickly, and they know they do it. So now the goal will be to, make a small amount of food last longer and really slow down eating. Now there's a number of ways to do it. One of them involves chewing thoroughly. This component not only slows down your eating, but it also helps you digest food better, which will be particularly important after surgery. So right now we, chew mostly probably 5 chews and swallow, pretty much whole food. And it may not faze you now. However, after surgery, this can lead to a lot of abdominal pain, just not feeling well, feeling nauseous, and worst of all, vomiting. So no matter what you're eating, you can already start chewing 20 times, or until applesauce consistency. This is going to feel very unusual in the beginning, but it will go to show just how much chewing actually needs to be done for healthy and safe digestion. You could start, you could start this by cutting food into small pieces if you're used to taking big bites, or trying to take a bite half the size and seeing like, oh, maybe this actually kind of works for me. So behaviors around drinking. So after surgery, the official rule will be to not drink anything 30 minutes before or after meals. Now you could ease your way into this and work up to it by basically starting with taking very small sips during meals, or trying to not, take as frequent sips. Now, this is another one of those habits that may not faze you right now, but after surgery, again, such little simple mistakes like this can cause pain, discomfort, or vomiting. So lots of times we're not so much thirsty when we're eating, we're more just our mouth is dry or there's some kind of taste. So the way I tell people first, to start easing out of this habit is to try to take a tiny sip, just enough to coat the mouth, and see if that may be actually effective. Because do we really need to take a huge chug of water as we're eating? Usually not, but sometimes we want to, relieve the mouth dryness. Generally speaking, sipping small sips will be the way to drink whether you're eating or not. Big gulps can add air into this, the stomach or pouch, as we call it, and also cause a lot of pain and discomfort. Another way that air gets into the stomach with liquids is drinking carbonation and also using straws. Both of these things will no longer be able to be done after surgery. They're really the only things that have to be given up indefinitely. So basically, a straw has air in the straw, and then when you inhale the liquid, the air goes in first, then the liquid. And carbonation also is bubbles, air, and liquids. Again, will just be really difficult for your stomach to handle after surgery. So this includes any kind of sodas, Coke, Sprite, even seltzer, also beer. When it comes to drinking, you will still want to be well hydrated after surgery. You're still going to want to have 64 ounces of fluids daily, or 8 cups. And essentially, you'll just have to drink them in a different way. You won't be able to take down, a whole bottle of water in 2 sips. You'll have to stretch it throughout the day. That's why, it'll be good to start practicing taking a small sip, of water, preferably every few minutes. So if you still need flavor in your water, you can always use alternatives like Crystal Light, the Mio Drops, True Lemon Lime. It's another product, basically for the flavor instead of carbonation. 2 beverages that you will temporarily have to pause is alcohol and anything with caffeine in it. So coffee, tea, definitely Coca-Cola. You have more than one reason to stop that. Now, the caffeine is temporary, same with alcohol. The reason that this needs to be paused is because it will interfere with the healing of your pouch, of your new stomach. And the slower you heal, the longer it will take to get back to more or less normal eating habits. So the acid in caffeine and alcohol can delay the healing, keep the wound irritated, keep it from healing, may also even damage the stitches. So it's definitely something worth endeavoring in. Now, you don't have to stop drinking caffeine now. We tell you this in advance so you can start practicing how you are going to wean off of these products, because some people can go cold turkey, other people need to slowly decrease amounts or gradually switch to decaf, which is allowed. Decaf coffee and tea are indeed allowed, so that's good news. And again, this is temporary. So overall, the things we'll be working on nutritionally is eating on a schedule, not skipping meals, eliminating junk food and fast food. Those things, you want to start eating healthy before you go through the surgery. So again, you're used to the new normal, and that's also important because through this program, you don't want to gain weight. Insurance companies will not cover and doctors will not operate if they see a weight gain, because it shows that there is some non-compliance and that, the process isn't really being taken seriously. So lessening portions will also be part of this whole, process to improving your nutrition and eventually losing weight. Now, the most important nutrient that we will be focusing on in the beginning is protein. The goal will be to get at least 70 grams of protein daily and start looking for food sources of protein that you like, and try to start consuming it with every meal and snack. In the book, there's a list of basically where protein comes from. Most of this shouldn't be a surprise, comes from meat, dairy, and a few, beans, legumes, things like that. The reason this list is here is for you to roughly know how much protein is in something, and also, just for you to see it all in front of you and start looking at what you do like, what you can, kind of start seeing in your day. A lot of this can be snacked on, like yogurt, hard-boiled eggs, things like that, throwing chickpeas in your salad. There's a lot of ways to go about this. So the reason protein is so important, particularly after surgery, is that it will help you also heal after surgery. Next, our muscles and our organs and our hair, skin, nails, a lot of things, even hormones, our immune system, all of that is made of protein. And when you will be rapidly losing weight, you want to make sure you eat enough protein for the body to be able to restore and keep keep your body from using protein muscles as calories. Rather have the body take the calories from fat. So the amount of protein you will need after surgery is pretty similar actually to the amount of protein you need now. It won't matter how much weight you lose. You will end up cutting calories by reducing carbohydrates and fat. Protein can also help curb hunger between meals, which is also really important. And it will help the body burn fat instead of muscle, because it's the protein you eat is restoring the muscle. So protein can, of course, come from dietary sources or food. This is generally preferred. However, after surgery, you're going to be on a liquid diet for quite some time, and protein shakes are going to play a pretty important and significant role in meeting your protein needs. So there's a lot of different brands out there. We have a lot of product ideas on page 14. However, if there is a brand that you like that's not on our list, you would just have to look at the nutrition label and make sure that the main ingredient is whey protein, and that there are at least 15 to 20 grams of protein, and the whole product is less than 250 calories and less than 5 grams of sugar. We want to get the maximal protein for the minimal calories and carbohydrates. Now, again, this phase with the protein drinks is, we're looking at about 2 months of your life where protein drinks play a significant role. And then eventually you will want to wean off of those and get your protein needs from real food. And then about 6 months after surgery, where a lot of weight's already lost, your body is kind of stabilized, you will shift your focus from protein to produce, to eating fruits and vegetables, to having more balanced, balanced nutrition. The other component of bariatric surgery of successful results is vitamins and minerals. You will need to supplement for the rest of your life. Basically, the regimen that is recommended for the bariatric protocol involves a multivitamin and calcium. That's really it. So the reason is you need to supplement is that you're not eating as much food, and also your absorption is changed because a lot of your stomach is no longer in use or has been removed. Since a lot of vitamin absorption takes place in the stomach, we need to add extra supplementation in the form of, tablets, chewables, things like that, because you just won't absorb everything. In particular, B vitamins and iron are the hardest to absorb. That's why a bariatric brand of multivitamin has additional content of B vitamins and iron. In general, I'm going to do a separate presentation on what kind of supplements you need and a little more details about how to find the supplement that's right for you. So in general, like I said, a multivitamin in the morning, 1 calcium in the afternoon, 1 calcium in the evening. So it's not too involved of a process. The main thing to remember is that gummy vitamins will no longer be allowed because they will not absorb properly. They're not good enough quality for a bariatric patient. And for the first 6 weeks, things need to be either soft chew or chewable. And I will provide supplements in my office as well whenever your next visit is with me. So overall, we'll be working on a few components to good nutrition for bariatric surgery and beyond. Basically, this will involve decreasing your portion sizes to really not overstuff yourself, to read food labels, start noticing the fat content, start noticing the sugar and the protein content of products, learning your hunger cues, basically, to learn to stop eating when you are not yet overstuffed, too full. There's also some trial and error with protein shakes. You want to find something that you like before surgery so you don't have to do the trial and error after surgery. And also sampling some of the vitamins that I provide or purchasing something else that you want to use as long as it's within our guidelines. So for first time reading, I tend to recommend pages 20 through 40, where, the things I just spoke about, mostly, protein and vitamins, as well as the hows of eating. Page 35 through 41 has some good frequently asked questions, a little explanation of why certain problems happen after surgery and how to prevent them. A lot of them are very preventable by eating properly. And then optional reading, page 47 through 58, the psychological self-reflection, I think may be useful for some people. There's always some sort of emotional component involved to wanting to lose weight and losing weight. So if something resonates with you there, there's also additional reading material for that. So that concludes the introduction to the Bariatric Nutrition Program. Your next upcoming appointments will be individually with me, followed by a group class of the pre-op information where I talk about all the diet progressions that happen after surgery. So I will be seeing you hopefully soon for our next appointment, and welcome to the program.